Good afternoon and welcome to the Tuesday, April 9th meeting of the Department of Social Services Board. I would like to call the meeting to order and observe a moment of silent prayer or silent meditation. Amen. Do we have any public comments today? No. Okay. So then it would be in order to adopt or revise today's agenda.
Madam Chair.
Yes, ma'am.
I would like to revise the agenda to add a closed session at the end of the meeting to discuss a client issue.
Okay. And Susan, are you prepared to quote the statute when we go into closed session? Okay, and then I would just like to add one item under discussion, and that is the director's annual evaluation, just to talk about the process since year end is coming up, if that is okay. So any other adjustments?
Move approval as amended.
Is there a second?
And I'll second that.
All righty, all those in favor, let it be known by saying aye.
Aye. Aye. Oh, we got the push button?
Then the first order of action on this agenda is to adopt the meetings of our previous meeting. Are there any changes needed to those minutes?
No.
Is there a motion to adopt the minutes as presented in the agenda?
So moved.
Is
And I'll
there-
second.
All right, it's been moved and properly seconded to adopt the minutes as presented in the agenda. All those in favor, let it be known by saying aye.
Aye.
Okay, we have one item on our consent agenda today, and that is a GUC neighbor-to-neighbor budget amendment. And
Move
this,
approval.
all right, move to approve it. Is there a second?
I'll second.
Okay, and these are donations for the viewing public. These are donations that Greenview Utilities customers make on their power bills to be used for those who have heating and cooling issues. And they deliver it to DSS a couple of times a year. So it's been moved and seconded to adopt the budget amendment as presented. All those in favor, let it be known by saying aye.
Aye.
Okay. Then we reach items for discussion. It is child abuse prevention, and we have Keisha Adams and Monica Daniels and maybe Denise Moore Jones.
Yeah, Keisha Adams.
Start to say they're all listed, but I'm not sure who's in the audience.
Things happen.
That's okay.
Get your microphone.
All right, so I'm Keisha Adams, and this is,
Colleen Anderson,
and I
Okay.
supervise CPS assessments.
and I
Seems like
supervise
we don't
CPS in-home
hear
services.
Okay.
Then it seems like it's not coming through.
Maybe just,
It's
Yeah.
on.
It's on, so you
Try
just
it
need to
again.
get closer, yeah.
Your name.
Keisha Adams.
Now you
there you
Okay,
go.
so we gotta lean in. And like I said, I supervise CPS assessments, and basically we're here today to talk about briefly the process of when we receive a report and the process for as once we receive a report, if it meets the criteria for us to stay involved, the process for a CPS assessment.
okay, and for the viewing public, CPS is Child Protective
Child Protective Services.
Okay.
Okay, so anyone who feels that a child is being abused or neglected is required to make a report by law. Ways to make a report is basically they can call in to Social Services 902 1101 and request to speak to an intake social worker. We have 2 intake social workers. And basically we have a structured intake report form that we use that was created by the state and is utilized in all 100 counties in the state of North Carolina. It takes approximately 30 to 45 minutes to make a report. Sometimes people don't want to stay on the phone that long, but the report is strength-based. So we encourage people to, be patient and give the social worker that's taking the report what they need, because like I said, it's strength-based, every report we take, we try to get resources that are currently working with the families. We also try to find out what the family supports are, so that we can better know who to contact, as well as what they're already receiving, what they have received as we move forward. If the report is accepted, it's assigned to a assessment social worker. There's 2 tracks, family assessment and an investigative assessment. Depending on the allegations, determines which track the report is assigned to. With investigations, that's usually our more serious neglect reports. The allegations rise to the level of serious neglect. And then all physical abuse and sexual abuse reports are screened in as investigative assessments. Okay? Once that's done, if it meets the criteria, it's assigned to a social worker. And prior to July 2018, we had investigative assessments could take 30 days to complete. Family assessments could take up to 45 days to complete. Recently, it's changed, so whether it's a family assessment or an investigative assessment, we have 45 days to complete that report. And sometimes it may take longer depending on other agencies that's involved, other information that's got to be gathered, other information that we have to receive from other agencies. So it may go beyond the 45-day time frame that's set. We get information from collaterals that we receive from families. We may have to speak with professional collaterals that may include medical professionals, school professionals, and we go where the report takes us as far as gathering information. It's not penalty driven. I know a lot of times people see social services come knocking on their door. They feel like, we know it's an intrusion, but that's not what we're there for. We're there to assist families, if we can, if they're in a crisis or they've had a bump in the road, we try to put them in touch with resources in the community that can assist them. So with that being said, once we make a decision, if it's substantiated, there's 2 case decisions that's possible. Unsubstantiation means that we didn't find anything that rose to the level of us to continue to be involved. Substantiated, it may end up in home services, depending on the severity, or foster care. If there's imminent risk and we can't find any family members, if they can't supply any family members or support systems, it could be blood, relative, whoever their supports are. If they can identify somebody prior to placing a child in foster care, that's what we like to do, that's what we want to do, that's what we're required to do. And if it doesn't rise to that level and we transfer it to in-home services, if there's a need for continued involvement by the agency, then it goes into the in-home services unit. And I'll let Colleen speak today.
So I'm Colleen Anderson, and I do the in-home services. So once that report is found in need of services or substantiated, it comes to in-home services, and it's going to come with some recommendations. The goal of in-home services is to work with the family to help them safely maintain their children in their home, to address whatever the safety concerns are that they found during the assessment, and to reduce the risk of future maltreatment. So we're going to take whatever recommendations they have found in the assessment, and we're going to have a child and family team meeting. We have that within 30 days of the decision. And at that meeting, we sit down and we look at what the recommendations are and what activities we can do to address those. So depending on what it is, if it's a supervision issue, then we may look at some parenting classes that we could look at to help understand what kind of supervision different developmental levels need. Just whatever the issue is, we look at activities that we could use to address those. The social worker and the family make that plan together, and then we work forward on that plan. Every 90 days, we review that plan. At the second child and family team meeting, we want to be looking at progress. We want to be looking at the possibility of closing the case. If we are not looking at progress, then we start to look at court involvement and seeing about having a judge order the things that we're asking the family to do. At any given time, there could be a new report. If a new report comes in while it's in in-home services, then that worker would do that assessment. So they would do the process that Keisha just talked about, but it would be the worker who's already working with the family, already knows them, instead of having 2 workers coming into the same house. And then hopefully we can accomplish our goals and move along and leave the family better and with more resources than when they met us.
And we are talking about Child Protective Services today because April is,
Child Abuse Prevention Awareness Month, which leads to our event that we're hosting on April the 28th at the Greenville Town Commons. We've also had a walk on April the 1st. April the 5th was Wear Blue Day. And then as an agency, we got together and we started to talk about we wanted to do something different this year to highlight and educate people regarding child abuse awareness and prevention. So we decided to make it a fun day, a festival day, to get the community out, to bring everybody together and make them aware of the effects of child abuse, the effects of neglect, and then we also wanted to bring our community partners in so that people know where to go when they're in a crisis or when there's something going on and they don't know how to handle a situation. They would know where to go. So we looked at the different reasons how we can sometimes get involved based on our screening tools. And with regards to abuse, it's physical abuse, emotional abuse, cruel, grossly inappropriate behavior modification, sexual abuse, moral turpitude, and human trafficking. Then on the neglect side, when we get involved and we screen in a report, some of the criteria could be improper care, improper supervision, improper discipline, improper medical and remedial care, illegal placement of adoptions, injurious environment, abandonment, substance abuse, substance-affected infant, domestic violence, and dependency. So we reached out to all our resources in the community to target each of these areas, to bring them all together so people can know who can I seek when I'm in need or I got a situation going on. So we have people there, Triple P,
Triple P.
Triple P, the parenting, Positive Parenting Solutions. We have an array of people from the health department. We even have, because sometimes we get reports concerning lice and bed bugs and roaches. We have the people coming out from the health department to educate people on how to get rid of those infestations when they possibly have them. We have mental health providers, physical health providers, the health department, Teddy Bear, Trillium, everybody pretty much resources so people can know and
So-
get information.
20, 30 vendors out there that day?
Right now, I have 25 plus.
Great.
Yes, 25 plus. And that's outside vendors. That's not including our own in-house exhibitors that we're going to have.
You will be sharing how the general public, I'm really big about how the general public can access the services we have. So at the April 28th thing is when you're going to have all of this?
Yes.
And resident will be informed as to how to access services that the county has relating to social services.
Yes, that's the whole plan and that's the purpose. So people can know how to access and where to go. We have Access East coming out. So we touch base in just about every arena to have people from Pitt County there so that they can know who's here and what services they offer. And we can give you guys a preview of our efforts to advertise this event and promote this event.
The Pitt County Department of Social Services invites you for food, fun, and live music at the Child Abuse Prevention Awareness Festival, April 28th from 2 to 6 p.m. at the Greenville Town Common. Connections matter. Our community, our village.
And a lot of our work is
The
done
Pitt County-
in-house through the public information system.
So is that running on the county's channel?
Yes.
Have you asked if it could be run on the City of Greenville's channel?
I will talk to public information.
I mean, that's another venue to get
Yes.
it out there because a lot of people watch that government channel as well.
And that other one too,
The channel 24,
20,
25.
whatever it is.
Yeah, we have radio.
I would call it Jake Postma's channel.
That's
That's
what
who
I
started
call
it.
too.
but
I don't know who runs it
now.
but it's Jake's.
We have radio. We have some large banners that we're going to have on different locations within the community, advertising the event as well.
Well, since it's at the town commons, that's why I thought maybe the city of Greenville would run your ad, or run the clip there as well.
I'm sure they will run it for us if we just ask them. I don't know if we have yet. And you've got a lot of TV, the TV stations have run it some.
Channel 9, they will be there.
Great.
We have 95.5, the radio station, they will be there. They will do a live remote. So they'll have a DJ on site, and he'll cut into the live broadcast 3 times an hour while he's there. And they're going to have giveaways for the public, and they're going to promote the event throughout this month.
Good job.
Great
And
job,
I
guys.
think we have an actual a radio clip that they're going to play for us today.
Sunday, April 28th from 2 p.m. until 6 p.m., the Pitt County Department of Social Service will be hosting a Child Abuse Prevention Awareness Festival. Connections Matter. Our community, our village. At the Greenville Town Commons on the corner of Greenie and 1st Street, the Pitt County Department of Social Service, along with the community partners, will share information on housing, mental and physical health, education, and parents. There'll be food, music, live entertainment, bounce houses, face paintings, plus more. Sponsored by Triple P Positive Parenting Solutions, Integrated Family Services, and Bullock's Paint and Body Shop. Don't miss the Child Abuse Prevention Awareness Festival, Sunday, April 28th in Greenville.
High energy,
Wonderful job.
high energy ad,
A
yes.
lot of energy.
Would it be
That was
possible
great.
to send the, a PDF of the, flyer, and we can send it out to, with our school nurses from the hospital, we can.
And that's what we're planning to do.
Okay, good.
We're working on with public information specialists. They're going to give us a gift for Facebook so that we can put the flyer up there as well as the video, and they're going to set it up so that we can send it out to everybody
Perfect.
to
Thank you.
advertise.
The school system has a public blast that they do, that the parents listen to all the time, so that's a good, but this is just great.
Yeah.
This is really great.
We're going to entice all those children over from the playground, aren't we?
And we actually got a motorcycle club involved. They want to be involved, and they said they have a huge following, and I think they're street soldiers. So they offered to pull out their grills and come out there and help cook up some food for the children. They said it's all about the children.
So will you do any recording the day of the event? So we'll
Public
have some
information
history?
is going to handle
That's great.
all of that.
Wonderful.
And Prevent Child Abuse NC is going to have their social media
Right.
person with us, and so she's going to be blasting on their social media page all day long.
Oh,
I think
good.
this is great.
That is super duper.
The more the public knows about our services, the better.
Okay.
And that we're a resource, we're a
Right.
That's
positive
right. We're a positive
resource.
resource.
Yes.
So thank you for all your hard work.
Great job, ladies.
All right, community plan to prevent child abuse, Jan, Jim, and Sheila.
And we're going to let Sheila start it maybe
She's our
if you want to.
Okay.
We'll pitch in where we need to,
All
right?
right. Our last meeting was on March 19th, and at that meeting, we elected officers. So Sharon Cooper with the partnership and Sheila Bunch, yours truly, were elected as co-chairs of this group. We discussed the training dates on protective factors, and those dates are May 29th, June 5th, and June 29th. And so flyers will be going out about that. So 3 days of training for our community partners regarding protective factors. We continue our asset mapping and to see what our strengths are, who needs to be at the table, and to make sure that those people are involved. We discussed the establishment of subcommittees, and usually prevent child abuse organizations in communities have 3. They have a speakers bureau, a data management committee, and parent engagement. And parent engagement is very, very important for this initiative. And we also at that meeting discussed our role in the activities that Keisha just talked about in terms of the festival. So, what did I miss?
I think
Ms.
you got
Elliott?
it. I did put a copy of the flyer for that training at your place, and feel free to share it with anyone.
Yes.
That one right there. So, So that's available, but I think you covered it. We're still in the beginning stages and got some, that's it right there.
That's it.
So we're trying to get that out to as many folks. This training, we have room for about 30 people to participate in this training, and this is being sponsored by the Prevent Child Abuse folks. They have some resources to do that. We can do additional trainings. We'll have to come up with some of the resources to do additional ones, but we're excited about moving this forward.
Sounds great. Sounds like
Is
progress.
it- Do you have this in the electronic that you can send it through email?
Yes.
I can
so
forward,
that-
we
so
can
that
forward a copy.
We can send it through our blast too.
Yeah, we can forward a copy. Again, we've only got room for about 30 people this time, so, but it's
Oh, so ain't no need of doing that.
not, we can't do too big of a blast for this particular piece. There will be other places that we could do much more reach
So
out to.
We'll wait this time.
Okay.
Okay, the item I added, and all I really wanted to do was, it's that time of year where the county does evaluations, so I wanted to share with you today a copy of Jan's work plan that was adopted by this board last year with the, it's right there.
Oh,
It's
okay.
right here.
All right.
This is yours, right there.
And so that we can do a comprehensive evaluation with all of our input, I would ask that you, the performance objectives or the factors are in bold, and then what it takes to meet, exceed, or far exceed. Literally, if you will just circle the one you think Jan has reached, and any comments, write it on the margin, get it back to me via fax, email, drop it with Jan, and or drop it with Susan in an envelope, and I'll pick it up. Then I will compile everybody's together so that we can get it to Jan in accordance with the county's timeframe for annual reviews. If you've got questions on it, again, these are the items we adopted last summer that Jan was going to work on for this fiscal year. So we would like to get it sort of compiled and back to her in June as the county's new fiscal year starts in July. So I just wanted to get that out to you so we could get her evaluation rolling.
When did you say you needed it back?
Anytime in the next couple of weeks.
Okay.
Like I said, if you drop it off with Susan, I'll run by and pick it up, or if you scan it and email it back to me, I'll add everybody's comments on one final copy. Thank you. Now it's time for Jan's Director's Report.
Okay. Medicaid transformation continues to move right along. There is a meeting tomorrow in Durham, sponsored by the County Commissioners Association, that I know several of our commissioners are going to. So that's kind of to give them a big overview of what's happening, since this will impact many county departments, health, mental health, the county transportation system, and social services. So that's why the commissioners are getting more information so that they can be thinking ahead. On March 18th, the department released the managed care final policy guidance for behavioral health tailored plans, eligibility and enrollment information, and that is on the department's website if anybody wants to go look at that. I don't print those off for you because they're very long and involved. The RFP has been issued for the Ombudsman services on March the 8th. So there will be folks bidding on that to be the ombudsman, provide ombudsman services for managed care. And what would happen is that if folks have complaints or concerns about how they're being served, then they would use the ombudsman to help them negotiate and navigate that process. That decision, the proposals will be open on April 12th, so we will know who those folks will be shortly after that. The Healthy Opportunities pilots, the RFI, request for information, went out February 15th. The request for proposals, where folks will actually submit, I'm going to call them bids for lack of a better term, that is supposed to be issued mid-2019, so somewhere around July. This is a pilot, and there'll be 2 to 4 regions selected for this, with a launch in November of 2019, running till October 31, 2024. So if you remember, the Healthy Opportunities project is to work with folks who present with medical issues and to then find out what are the services that might be also. Do they have food? Do they have a place to live? What kinds of things might they need help with, which could also impact their health? And so this is what this pilot's about. The federal government, I believe, has provided about $650 million to be used to try this out. And so the first year or so after the launch will be mostly getting set up, getting the data management system set up, getting everybody trained, and then it'll be a couple of years before we're actually running full bore on this. So that is coming. The joint trainings are beginning this month with social services, the enrollment brokers, and the prepaid health plans all in the same room. That first training is, in fact, Thursday of this week in Raleigh for that area. And so the first 2 regions, if you remember, will roll out in November. And we're not one of those, so we're still sort of lagging behind there. But those folks on June the 28th will begin to start getting information about selecting a plan. Those mailings will start going out. We do know that the prepaid health plans are trying to market to the beneficiaries now about, at least in those 2 regions, about please select our plan. We want you in our plan. And they are also out trying to get provider contracts established for transportation and with the other healthcare providers that they will need to work with. So that's ongoing. There are discussions also going on about community events and how we can connect our beneficiaries, our folks in our community, to the enrollment brokers so that they can talk and ask questions, and how to connect them with the prepaid health plans once that starts, because just sending them a mailing is real different from actually having a conversation and talking through what they can offer. So that will be coming to us in the near future. At least these other folks get the opportunity to try different things out and see what works best before we get here. So that's pretty much what's going on right now with Medicaid transformation. It is a very busy time. We have weekly, I'm on the transformation rollout committee, and so we're having weekly conference calls pretty much to talk about who needs to do what. For a little while I thought I was going to the mountains to talk about the DSS role as it relates to the when we did the training for the PHPs and the DSSs and the enrollment brokers together, but we finally found somebody out west to go do those, so I don't have to do that. But so it's a really busy time for everybody. The MOU, we're still trying to figure out how to data validate, and thus far the data hadn't been validated, so we're still working on that with the state. So not a whole lot to add there. I will say that as a result of the Social Services Working Group and the work that was done in there, there was some interest in slowing down NC FAST to get a better sense as to whether it was going to be serving the purpose it needed to serve, and was it the best vehicle. And so there have been a couple of bills introduced in the legislature to suggest that this be studied and that there be no further rollout for some months to come while this is being studied. That those bills have not passed yet. I believe I sent y'all a copy of the letter and the email that I sent to our delegation. The letter was one from our associations saying we wanted to support that recommendation, and then we had then each of us reached out to our local delegation. So that is going on. You have a copy of the Medicaid application processing report in your packet. As you see, for the month that just finished, the month of March, we were not successful in reaching our MAD processing time frame. We had to be at 90%. We were at 89%, and our data analysts wanted to make sure everyone understood that we were actually at 89.6%, but the state does not round. And so, we had 2 cases that were held up in the MAD area because of help desk ticket issues. One of them was held up for 199 days. And so we are asking for a waiver, and that has been submitted. Those 2 cases that were held up would get us at a 91% rate. And so we suspect and expect that we will get that waiver, and will therefore continue to be at 100% on meeting our timeframes. You can see our processing times, even with MAD, we were at 60 days, and considering we had those 2 cases, that was still a good processing time. So staff are doing a great job. Kevin did throw in for you some data from the state, so you can get a sense of what the statewide average is compared to where Pitt County is. So I'll answer any questions anybody has on that.
With the MOU,
Uh-huh.
from county commissioners, we've been hearing about there may be some penalties and stuff. Are they holding up penalties, or are they still going to assess penalties?
That is still, there is still the option for going that way. But right now, until you can validate the data, it would be difficult to hold folks accountable. So July 1, they are expecting to have the data validated by then, and every month they're doing a little bit with data validation. And they're also going to, instead of saying, for example, Pitt County has to be at 95% in a certain area, they are supposed to be negotiating with each county a place to grow to. It's a growth measure as opposed to an absolute measure. They have not done that yet with the counties. So all of that has got to be done between now and July 1, when the next MOU has to be signed. But yes, takeover is still a part of it. Now, there has been some talk from the department about removing the withholding of federal dollars if you fail to meet the requirements. But right now, it's still in law that they can do that. So, any other questions there? If not, I'll move to the personnel report. As you can see, we are down to 12 vacant positions. And we are moving right along on getting those filled. And in fact, I want to say that the 2 that we have marked here as frozen have both been released. Susan, is that correct? So we are actually actively recruiting. Something else I wanted to point out is I've been looking at, I have folks calculating, Susan and Kevin do the calculations for me, and we are now from the point that a position closes, from recruitment, when it closes, to the point we make an offer, we're now doing that between 42 and 50 days. So that is much improved over where we were. Now, there's still some lag between the time we make the offer and they can come to work, and some time before the position's released by the manager to advertise. But, so we're moving into the range that we wanted to be into.
Are we having any retention problems? Because the other county commissioners are talking about that.
A turnover has been a problem. Certainly, it's a problem in all 100 counties, especially in child welfare. Adult Services in Pitt County has gone through a round of turnover just because of retirements and some other kinds of things like that. So once we tend to promote from within a lot, which means that you have a churn, because when you move one, that means you've got another one to move. If you looked at our fiscal year last year, our turnover rate was, I want to say, between 20, in some areas was as high as 25 to 35%. In other areas, it was much lower. If you looked at the calendar year last year, we were averaging agency-wide about 18%, which is pretty normal for this kind of work. 20 to 25 is not unusual in social work fields. So,
I want to ask you a question relating to the program at Pitt Community. Has that been fruitful for the social service?
oh, yes, ma'am.
I
Would you not say yes, ma'am?
I haven't heard it too much.
Right. We initially agreed to Anybody that we hired that had not had the NC Fast training, for those who don't know, Pitt Community College offers an NC Fast training program for folks who are interested in working in social services. And it is a state-approved program, and in fact, they contract with some of our own staff to teach that program. And so it teaches basic navigation in NC Fast and gives you a little bit of program overview for food stamps primarily. So we initially contracted with them and said that anybody that we had come in within their first year, they had to go through that class. So that was a way to help build initially. Now, we're getting a lot of applicants that have already been through the program and who have taken their CRC and are scoring, gold or better. So we've really been pleased with it. I think it's bringing folks in, even who have no experience in the department, with a step up. You've still got a lot of training to do, but it means that they have a little bit coming in the door.
It gives you some basic.
Yes, ma'am.
Yes, ma'am.
So we're using that. We've been pleased. And I think, Brian, don't they have a waiting list right now for that class? Did I not hear that?
Oh, wow.
Yeah. So it's a popular class. And the other community colleges around us are doing it. I think we've gotten a couple of folks from Beaufort Community, a couple from Lenore. So, it's being taught where the folk are.
That's good. That's good.
Great.
Okay, so the next thing on our list was the crisis and energy program. Michelle gave you an update on crisis just to let you know what had been spent through April 8th. You see that we've already obligated $700,000 of our $1 million. Will we spend that entire $1 million? It's probably not going to happen because we're now getting into a time period where folks don't necessarily have the medical conditions or needs, and the temperatures certainly aren't hot enough or cold enough to cause a medical-related crisis. But we will spend a good portion of this. We may not spend it all. And remember, this was an increase from what we had last year, and the rules changed such that we cannot pay anything other than your light bill. We can't pay the sewer and the trash and all those other charges that come on that bill. So that reduced our spending somewhat. And then Brian has provided for you his report through the end of March. Right, through the end of March, is showing you as of April 3rd, he had 12 applications pending, and the program had shut down the last day of March. And Brian has some updated figures. Brian, do you want me to give them, or do you want to give them? Okay. So they still have 5 applications that haven't been processed yet. So they have definitely moved. They're just about through. I think the final processing date is April 16th is the last day we have to process a case, but we're going to have them done before then unless we're waiting on a piece of information. We denied 684 households this year and approved 3,559 households. We, however, at this point, unless those last 5 are getting the maximum allotment, we would anticipate spending leaving about $150,000 unspent this year. And again, we had about a $200,000 increase over last year in both these crisis and low-income energy. So, and the community partners, we really love the community partners because they took 739 of these applications for us. And so that was a big, big help. That was 739 people that didn't have to get in a car and come down to the DSS. So, big help, big
Does that
help.
money turn over?
That money will go back to the state.
Okay.
And we are trying, because most counties did not spend their money or did not anticipate in spending all the money. There's some conversation to see if the federal government would allow us to maybe shift it to crisis, although most counties aren't spending all their crisis money, or see if they could do something with a supplement to the individuals who were approved, to help, again, add a little bit of extra money to their bills that are sitting out there. So, but the federal government will have to approve it, so we don't know whether that'll happen in time or not.
I'm hoping they will do something with the crisis that people have with their energy.
So we'll see. We'll see what they wind up doing. So those were my critical things. I had a couple of other things to share with you real quick, and one is the budget meeting. We met with the county manager and our chief financial officer over there, assistant county manager, around our budget, and at this point, we have been told to rework our budget, taking 11 positions out of it. But that left 13 in there. And I suspect we will hear further guidance around removing other amounts of people and money, but we have not. That's the first cut after that meeting.
I want to ask a question.
Yes, ma'am.
In all the activity involving social services and opioids and this and that, and your ask for these positions to cut, and then to hear about the penalties and the waivers. Are our administrators aware of impact
Certainly, we
of
talked.
denying the full ask?
Right, we certainly had
I
that.
expect some
right.
of them are going to be cut, but
Yeah.
11 of them.
We certainly had the conversation, and I certainly believe that I was heard on that. But again, I also understand that there's only so much money that the county is able to generate. And so I understand the push-pull there. I have already gone on record that I will be at the commissioners' meeting asking back for all 24. So we will see where that goes.
And they know why you need them.
Yes, that was explained. Okay, so that has transpired. That was April 1st, and I was assured there was no message there with it being April 1st. The child support, I want to recognize two of our folk, Wanda Murphy and Christina Carter, were number 7 and number 8 in outstanding collections. One had a $12,493 purge payment, and the other one had a $12,293 lump sum from Social Security. So we are excited that our folks were able to generate that and get those dollars to a family. So that was great,
Congratulations.
and wanted to recognize
Michelle,
their
you'll
good
tell them?
work.
When,
we said
when they do
congratulations?
something extra like that, what do we do as a board?
I don't know, that's why I said, Michelle, will you tell them we said congratulations?
Congratulations.
We send smiley faces and balloons on
Okay,
computers
all right.
and those kinds of things to
Okay.
folks. So that's the end of everything I had.
Motivation for continued trying.
Ken, I had the opportunity to attend the commissioners' meeting for a little while, and you also had a number of employees that were recognized for
Right.
longevity.
Right.
as well, which was nice.
It's good to have that, yeah.
So next, let's go into closed session, or do we want to do board member comments before we go into closed
Let's do the
session?
board member comment
Okay.
after the closed session.
After the closed session, okay, so Susan,
Madam Chairman, I make a motion that we go into closed session.
okay, is
And
there
I'll
a
second.
second? And Susan, can you read us into closed session? And Jan, do you need any of your employees to stay?
I have asked for Susan to take the notes, Gwen to be available, and Angela to stay.
Okay.
General Statute 143-318.11, closed sessions, permitted purposes. It is the policy of this state that closed sessions shall be held only when required to permit a public body to act in the public interest as permitted in this section. A public body may hold a closed session and exclude the public only when a closed session is required pursuant to number 1, to prevent the disclosure of information that is privileged or confidential pursuant to the law of this state of the United States, or not considered a public record within the meaning of Chapter 132 of the General Statutes.
Okay. So. We are now back in open session, and no action was taken during the closed session. So, board member comments, starting with Dr. Bunch.
I'd just like to commend the agency and the workers for their enthusiasm around preventing child abuse during this Child Abuse Prevention Awareness Month. There's lots of enthusiasm around the activities, and so I'm very excited about that.
Great. Thanks, Mayor.
I would like to encourage all the residents to attend that April the 28th Greenville Downtown Boardwalk event. You will get to know a lot about what happens with social service, and I strongly encourage you to take the whole family.
Yeah, just want to just agree with that, and I think it's going to be a wonderful event, and I commend the staff for all the time and energy they put into that. So, good deal.
And the next meeting is, I'm sorry,
I'd
Kathy.
agree with him. It's great.
So I was going to actually close
Amen.
with Jim, and then
Madam Chairman?
So, next board meeting is May 14th.
SSI, any of y'all want to go to SSI? The Social Services Institute, it's
Oh,
on
goodness.
here.
The one that is July 30th
30th
through August 1st.
I
in
need to
Hickory.
know who wants to go. You can tell me later, but I need to know pretty soon.
Okay.
Okay.
Different time of year.
Trying to avoid hurricanes.
Yes. Wow.
It's trying to avoid
So-
hurricane season.
Madam Chairman, if I'm in order, I'd like to move that we adjourn.
So, is there a second?
Second.
We are adjourned.
Sorry, I forgot
Where
that.
is the SS?